Are you an adult living with obesity or overweight? Perhaps also dealing with obstructive sleep apnea? Have you heard about Zepbound and wondered if it could be a treatment option for you? This video provides essential information about Zepbound, its uses, how it works, potential side effects, and important considerations. Zepbound tirzepatide is an FDA-approved medication. It is used for chronic weight management in adults. This includes individuals with obesity or those who are overweight with weight-related medical conditions. Zepbound is also FDA-approved specifically to treat moderate to severe obstructive sleep apnea, OSA, in adults with obesity. It is administered as a once-weekly injection under the skin. Zepbound should be used alongside a reduced-calorie diet and increased physical activity. Zepbound is classified as a GIP and GLP-1 receptor agonist. It mimics the action of two natural hormones in your body, GIP and GLP-1. These hormones play a role in controlling appetite, blood sugar, and digestion. By activating these receptors, Zepbound slows down how quickly food moves through your digestive system. This helps you feel full for a longer time, which can lead to eating less. It also prompts the pancreas to release more insulin and reduces sugar production by the liver. This dual action contributes to weight loss. It may also help improve blood sugar levels, although Zepbound is not specifically approved for diabetes treatment, like its counterpart, Mounjaro. Zepbound and Mounjaro contain the same active ingredient, tirzepatide. Both are made by Eli Lilly and Company. However, they have different FDA-approved uses. Mounjaro is approved for treating type 2 diabetes. Zepbound is approved for chronic weight management and obstructive sleep apnea in adults with obesity or overweight with related conditions. Both are given as weekly subcutaneous injections. They are available in the same strengths, from 2.5 milligrams to 15 milligrams. Zepbound is available in single-dose pens and single-dose vials. Mounjaro is currently only available in single-dose pens. Clinical trials have demonstrated Zepbound's effectiveness for weight loss. In the SURMOUNT-1 study, patients using Zepbound lost significantly more weight than those on placebo over 72 weeks. Patients on the 5 milligram dose lost an average of 35.5 pounds, 16.1 kilograms. Those on 10 milligrams lost an average of 48.9 pounds, 22.2 kilograms. Patients on the 15 milligram dose achieved the highest average weight loss at 52.0 pounds, 23.6 kilograms. Compared to the placebo group, who lost an average of 5.3 pounds, 2.4 kilograms, Zepbound showed substantial results. Individual weight loss results can vary based on many factors. Zepbound has also shown positive results for obstructive sleep apnea, OSA, in adults with obesity. The SURMOUNT OSA Phase 3 trials evaluated its impact on OSA severity. After 1 year of treatment, 42% of adults on Zepbound had no sleep apnea or only mild, non-symptomatic OSA. This compared to only 16% in the placebo group. Patients in the Zepbound group also experienced significant weight loss. On average, OSA patients treated with Zepbound lost about 45 pounds. This represented approximately 18% of their body weight. These results highlight Zepbound's potential benefit for this specific population. The SURMOUNT-5 clinical trial directly compared Zepbound tirzepatide to Wegovy semaglutide for weight loss. This head-to-head study involved adults treated for 72 weeks. Both medications were used at their maximum tolerated doses. Zepbound demonstrated significantly greater weight loss compared to Wegovy. The average weight loss with Zepbound was 50.3 pounds, 22.8 kilograms. With Wegovy, the average weight loss was 33.1 pounds, 15.0 kilograms. In terms of percentage of body weight lost, Zepbound patients lost 20.2% on average. Wegovy patients lost 13.7%. This represents a 47% greater relative weight loss with Zepbound in this trial. More participants on Zepbound achieved significant weight loss milestones. 64.6% of Zepbound users lost 15% or more of their body weight. Only 40.1% of Wegovy users reached this same goal. Waist circumference reduction was also greater with Zepbound. The average reduction was 7.2 inches, 18.4 centimeters. Wegovy users saw an average reduction of 5.1 inches, 13.0 centimeters. These findings from the SURMOUNT-5 trial, published in the New England Medical Journal, indicate Zepbound's superior efficacy compared to Wegovy for weight loss in this specific study population. Like all medications, Zepbound can cause side effects. It's important to be aware of these and discuss them with your healthcare provider. Most common side effects are gastrointestinal in nature. Common side effects reported in clinical trials include nausea, 25%, diarrhea, 19%, and constipation, 17%, indigestion, 9%, abdominal pain, 9%, and vomiting, 8%, were also frequently reported. Injection site reactions occurred in 6% of patients. Other common side effects occurring in 5% or more of patients included fatigue, hypersensitivity reactions, and hair loss. These common side effects were generally mild to moderate and often decreased over time. While less common, serious side effects can occur with Zepbound. These require immediate medical attention. Serious gastrointestinal issues, acute kidney injury, and gallbladder problems are potential risks. Acute pancreatitis, inflammation of the pancreas, is a serious concern. Symptoms include severe, persistent pain in the upper abdomen, sometimes radiating to the back, with or without vomiting. If you experience these symptoms, stop using Zepbound and seek emergency medical help. Serious allergic reactions are also possible. Signs include hives, difficulty breathing, swelling of the face, lips, tongue, or throat, or feeling lightheaded. Get emergency medical help if you have these symptoms. Low blood sugar hypoglycemia can occur, especially if Zepbound is used with other diabetes medications like insulin or sulfonylureas. Symptoms may include headache, hunger, weakness, sweating, confusion, irritability, dizziness, fast heart rate, or feeling jittery. Diabetic retinopathy complications have been reported in patients with type 2 diabetes. Suicidal behavior or thoughts are a rare but serious potential side effect. Food or liquid getting into the lungs during anesthesia or deep sedation is another risk due to slowed gastric emptying. Call your doctor immediately if you experience severe stomach pain that won't go away, vision changes, signs of a thyroid tumor, lump in neck, hoarseness, trouble swallowing, symptoms of gallbladder problems, chalky stools, pain after eating, severe upper stomach pain, symptoms of low blood sugar, or signs of kidney problems, little or no urination, swelling, fatigue. This is not a complete list. Always consult your doctor for medical advice. Zepbound carries a boxed warning regarding the risk of thyroid C-cell tumors. In studies with rats, tirzepatide and similar medicines cause these tumors, including thyroid cancer. It is unknown if Zepbound causes thyroid tumors or a specific type called medullary thyroid carcinoma, MTC, in humans. You should not use Zepbound if you or your family have a history of MTC. It is also contraindicated if you have multiple endocrine neoplasia syndrome, type 2, MEN2, a genetic condition causing tumors in endocrine glands. Report any symptoms of a thyroid tumor, such as a lump or swelling in your neck, hoarseness, trouble swallowing, or shortness of breath, to your doctor immediately. Your doctor may perform tests to monitor your response to Zepbound. Zepbound is not suitable for everyone. Do not use Zepbound if you are allergic to tirzepatide or any of its ingredients. A history of personal or family MTC or MEN2 syndrome are absolute contraindications. Before starting Zepbound, tell your doctor about your complete medical history. This includes any history of pancreas problems or kidney disease. Inform them if you have severe stomach problems, such as gastroparesis, slowed stomach emptying, or problems digesting food. If you are planning surgery or any procedure requiring anesthesia or deep sedation, inform your doctor you are taking Zepbound. Also, mention if you have diabetic retinopathy, a complication of diabetes affecting the eyes. If you are pregnant, plan to become pregnant, or become pregnant while using Zepbound, tell your healthcare provider. It is not known if Zepbound can harm an unborn baby. A pregnancy exposure registry exists to collect information on outcomes for women who take Zepbound during pregnancy. Zepbound can affect the effectiveness of oral birth control pills. If you use birth control pills, your doctor may recommend using an additional or alternative method of birth control. This is especially important for 4 weeks after starting Zepbound and for 4 weeks after each dose increase. Discuss the best birth control options with your healthcare provider. It is not known if Zepbound passes into breast milk. If you are breastfeeding or plan to breastfeed, discuss this with your healthcare provider. They can help you decide the best way to feed your baby while using Zepbound. Zepbound is administered as a subcutaneous injection once a week. It can be injected at any time of day, with or without meals. Common injection sites include the thigh, abdomen, or upper arm. It is important to rotate injection sites each week. Zepbound is available in pre-filled pens and single-dose vials. Your doctor will show you or a caregiver how to properly inject the medication. If using vials, a specific 1 milliliter syringe capable of measuring 0.5 milliliters is needed. You will typically start on a low dose, which is gradually increased by your doctor. Dose increases usually occur no more often than every 4 weeks. Follow your doctor's instructions carefully regarding dosage and administration. You can change the day of the week you inject Zepbound if needed. However, ensure there are at least 3 days between doses. Do not inject 2 doses within 3 days of each other. The usual starting dose for both weight loss and obstructive sleep apnea is 2.5 milligrams injected subcutaneously once a week. After 4 weeks, the dose is typically increased to 5 milligrams once weekly. Further dose increases may occur in 2.5 milligram increments after at least 4 weeks on the current dose. The recommended maintenance dose for weight loss is 5 milligrams, 10 milligrams, or 15 milligrams once weekly. For obstructive sleep apnea, the recommended maintenance dose is 10 milligrams to 15 milligrams once weekly. The maximum recommended dose for both indications is 15 milligrams once weekly. Your doctor will determine the appropriate dose for you based on your response and tolerability. Inform your doctor and pharmacist about all medications, vitamins, supplements, and herbal products you are taking. Zepbound can interact with other drugs. As mentioned, Zepbound can make oral birth control pills less effective. Discuss alternative or additional birth control methods with your doctor. Taking Zepbound with other diabetes medications, such as insulin or sulfonylureas, can increase the risk of low blood sugar. Your doctor will monitor you closely and may adjust the doses of your diabetes medications. Be prepared to manage low blood sugar if it occurs. Zepbound slows gastric emptying, which can affect how other oral medications are absorbed. Your doctor will monitor you carefully if you are taking oral medications with a narrow therapeutic index, like warfarin, or those that depend on reaching specific blood concentrations. This is not a complete list of interactions. Always consult your healthcare provider.